You know when you look in a medicine cabinet and see all the different options? You've got pills, creams, patches, inhalers. It's a lot, but it's definitely not random. The way a medicine actually gets into your body is often just as important as the medicine itself. So have you ever wondered why some drugs are a simple pill you swallow, while others have to be an injection or maybe even a patch you stick on your skin? Well, the answer is all about choosing the best route of administration for the job. Let's dive into what that really means. So here's our game plan. We'll start with the basic delivery challenge. Then, we're going to break down the three main highways drugs can take into our system: the enteral, parenteral, and topical routes. And to wrap it all up, we'll look at how doctors figure out which path is the right one. All right, first up, let's talk about the fundamental problem that every medicine needs to solve. How do you get it from the outside world to a very specific target deep inside your body? So, the official term for this is the route of administration. And it's really just what it sounds like. It's the path a substance takes to get inside you. You can think of it as the body's own internal logistics and shipping network. Now, to make this super simple, we can group all these different paths into three main superhighways. First, there's the enteral route. That's kind of like the scenic road trip through your gut. Then you've got the parenteral route, which is like a direct flight straight into your system. And finally, there's the topical route, which is like a local package delivery to a very specific address. Let's start with the path most of us are familiar with, the one we use all the time, the enteral route. This is our scenic trip through the gut. Enteral literally just means through the intestines. So this covers pretty much anything you swallow, whether it's a tablet, a capsule, or liquid drops. But it also includes rectal administration, like suppositories. When you swallow a pill, man, it goes on quite a journey. First, it has to dissolve in your stomach or intestine, then get absorbed into your bloodstream. And then, and this is absolutely critical, it makes a mandatory pit stop at the liver. This is called the first pass effect. It's where the liver metabolizes or breaks down a chunk of the drug before it even gets a chance to do its job around your body. Now, this is where it gets really interesting. Taking a pill is, of course, super convenient and usually the cheapest way to go. But the rectal route has this really unique advantage. Because the tissue there is so rich with blood vessels, it can absorb drugs really quickly. And, get this, it can partially bypass that liver checkpoint, that first pass effect. That means more of the active drug actually makes it into your system. But what if a drug would just get destroyed by your stomach acid? Or what if that first pass effect in the liver is just way too strong and breaks down too much of the medicine? Well, in that case, you've got to bypass the gut completely. And that brings us to our second superhighway. This is where the parenteral route comes in. The name just means beside the intestine. And that's exactly what it does. This is our direct flight, skipping the entire digestive system and delivering the medicine much, much closer to where it needs to go. The most famous examples, of course, are injections. You've got an intravenous or IV injection, which goes straight into a vein. The effect is almost immediate. We're talking 15 to 30 seconds. That's why it's so crucial in emergencies. Then there's an intramuscular or IM injection, like the vaccines we all get. It goes deep into a muscle. It's still really fast, about 10 to 20 minutes, but it allows for a bit of a slower, more sustained release of the medicine. But wait, parenteral is not just about needles. It's a huge category. Think about it. Transdermal patches that deliver medicine through your skin, inhalers that go straight to the lungs, even those little tablets that dissolve under your tongue, they're all taking the direct flight, completely bypassing the gut. And here is the absolute game changer with that direct flight. Because parenteral routes completely avoid the digestive system and that pesky first pass effect in the liver, they have what's called 100% bioavailability. That means the entire dose you receive gets into your bloodstream to do its job. Nothing gets lost along the way. All right, and that brings us to our third and final superhighway, the topical route. This is our local delivery service. Usually when we think topical, we think of a very local effect, right? You've got a rash, you put a cream on it. You have dry eyes, you use eye drops. The whole point is to treat that one specific spot without having the medicine go all over your body. But here's a little twist. Sometimes topical delivery is actually used for a systemic or body-wide effect. A transdermal patch, like a nicotine patch, for example, is applied to the skin, but it's specifically designed for the drug to be absorbed through the skin and into the bloodstream, where it circulates everywhere. So yeah, local application doesn't always mean local effect. Okay, so we've got the scenic route, the direct flight, and the local delivery. How on
earth do doctors figure out which one to use for a given situation?
Well, it's a really complex calculation. They have to consider the drug itself, like, is it a protein that would just get digested in the stomach? They have to think about the target. Are we treating a skin rash or a widespread infection? Speed is a huge one. Is this an emergency? And of course, they always have to keep that first pass effect in mind, along with the patient's condition and, what's most convenient for them.
So here's the crucial takeaway, the one thing to remember. The route isn't just about convenience. It fundamentally changes what a drug actually does in the body. The source material puts it perfectly. Identical drugs can produce different results depending on the route of administration. And there is no better example of this than the drug naloxone. If you give it intravenously, our direct flight, it travels straight to the brain and can reverse a life-threatening opioid overdose in minutes. It's an absolute lifesaver. But if you take that exact same drug as a pill, the scenic route, it's barely absorbed into the body. Instead, it acts almost entirely in the gut, where it's used to treat constipation caused by opioid medications, without affecting their pain relief at all. So think about that. Same drug, two different routes, two completely different outcomes. It's incredible.
So at the end of the day, it's all about trade-offs. The oral route is super convenient, but it can be slow and less efficient. The IV route is incredibly fast and efficient, but, it requires a medical professional. And then you have things like a transdermal patch, which can offer a great balance of convenience and steady, medium-speed delivery.
So from that scenic trip through the gut to the direct flight of an injection, the next time you take any kind of medicine, you'll know that the path it's taking into your body was chosen with just as much care and precision as the drug itself. And it really makes you wonder, right? With all this amazing research happening in nanomedicine and even direct neural drug delivery, what new routes are on the horizon? How precise can we get in delivering medicine to the exact cells that need it, and absolutely nowhere else?